Alright, so what we're going to take a look at now is just some of the different types of movements that we're going to see at these different joints. And again, as we start talking about muscles and the actions of muscles, this is what we're really going to be referring to of different muscles, that they adduct this or they abduct that. So again, your shoulder is a ball and socket joint. It is a multi-articulate joint. It's one that can do a number of different things. But you could talk about flexion of the arm. Flexion of the arm would be like I'm sitting here. It's the arm coming up like this. That would be flexion. You can talk about rotation. I don't know if you can see what I'm doing here, but if I'm standing up, rotating like this. Adduct is your arm coming back to your body like this. Abduct is going away. So again, adduction and abduction, you can kind of see here. Abduction would be going up and away, like abducted by aliens. Adduction, if you think about it, is adding on. So, and again, it is the movement, not necessarily the appendage. So it's not just arms. You can do the same thing with your legs. Abducting is going to be pulling the legs away from the center line. Adducting is going to be moving them towards the center line. Elevation and depression, lifting a part of the body in the frontal plane. Elevation, depression, dropping it back down. Protraction, moving a body part forward. Retraction, moving it back. So pushing out the chest, he's really retracting the shoulders. So, and a lot of limbs, we're going to talk about this one, decreasing the angle on the joint. So if this is the elbow joint, you're decreasing the angle, that would be flexion. So we talk about flexing a muscle, that's what it is. Extension is this opposite movement going back towards that zero position. I can't show it with the elbow, but you could talk about hyperextension, that's actually going past the zero position. If you do it with the hips, this would be flexion is leaning forward, extensions like this. Hyperextension is leaning back a little bit like that. So certain joints can do hyperextension. Sometimes hyperextension would be an abnormal movement. So you can kind of see it right here. So flexion leaning forward, hyperextension past that zero position. You could also talk about lateral flexion. Just extension would be going from that flex position back to a normal position. And then you can talk about making a small circle at the end of a joint. That is circumduction. Rotation is rotating one of the bones within the joint. So like here with the arm that's shown there, that is kind of rotating at the humerus. You can also see she's doing it on the hip, that medial or lateral rotation. Again, your ball and socket joints tend to have these abilities to do these rotational movements. Supination is the hand. Pronation, this is only the forearms. Palms face forward. So if you're standing like this, palms facing forward would be supinated. Pronated would be palms facing back. So supination, pronation, supination, pronation. And then you can talk about adduction. So abduction doing this, adduction would be doing this. Radial flexion would be towards the thumb side, because that's your radius. Ulnar flexion would be towards the ulnar side, the outside there. Flexion, extension, if we're talking about the fingers there. You can talk about opposition with the thumb, which is a movement only the thumb has. Also, like it's shown there, adduction of the hand, adduction of the thumb. Last few things to talk about here, can invert or evert the ankles. So eversion is kind of moving them to the outside. Inversion is moving so your kind of big toes coming up on the inside. And then at the ankle, you can have your zero position. If you're pulling your toes up towards your shin, that is dorsiflexion. If you're pointing your toe downward, that is plantar flexion. And so really the last couple of things look here, just some of these complex joints and showing you a little bit what's going on with them there. This is the shoulder, so you have the scapula and the clavicle making basically a strut coming like this that provides a structure to that joint. Then you then have the fossa on the end of the scapula that allows the arm to be there, but it's really this clavicle here and the scapula here going together at the acromion that provides a structure to that joint, gives you that structural kind of strut-like movement to, like if you think about a tire and what's kind of holding it in place. And And you can see, again, lots of ligaments and other stuff and tendons that are crossing over this joint to kind of hold it in place. Really not much of a socket. It's really a lot more of those reinforcing ligaments and tendons that make up this joint. But it's also why there's such good free movement in this joint, but it's also part of the reason why it's so easy to injure this joint. I could say ask my dad, who is actually currently visiting right now, and he just had shoulder surgery. Again, rotator cuff tears are when you a lot of times damage some of these tendons or ligaments. And again, because tendons, ligaments do not heal particularly well, a lot of times these are long-term injuries that are difficult to get back to a pre-injury state. Some of the other ones here, the elbow joint, another complex one here. It's kind of a combination of a hinge and a pivot joint. So you can see the hinge joint, it's right here. Pivot joint is kind of rotating on this point right here as well as around right here. And you have a ligament that's helping to hold that and keep that spacing correct so you can do that pronate and supinate. And again, you can see a number of different joints within the hand when you're talking about all these little joints here. You have sliding, gliding joints in between all the wrist bones, allow multiple degrees of movement there. And then you have those saddle joints at the base of the thumb, as well as all those different condyloid joints at the ends of the fingers. And this, you can see some of these costovertebral joints. Again, these are very much amphiarthrotic joints, cartilaginous in nature. So these would be a symphysis. Again, allow us to have a little bit of limited movement at each of those joints. But overall, that gives our spine a decent amount of ability to flex and move. When we start talking about it, adding on the fact that we have 30 plus vertebrae, with each having a little bit of limited bit of movement, it allows the overall spine to have a decent amount of movement. And again, the hip, very much a ball and socket joint. You can see a lot of ligaments and other stuff helping to hold that in place here. Very true ball and socket joint, much even more so. The socket is very obvious compared to even the shoulder joint. And again, you can see that here. The replacements, a lot of times when they talk about knee replacements or hip replacements, these a lot of times are replacing those joint surfaces and attaching a lot of times metal parts to the end of those bones. So you can kind of see that example here. They replaced the head of this. They have a shaft of metal going down into the femur to replace that, and then did a new socket here. Knee replacement a lot of times is just replacing a lot of times articular surface of the femur. Sometimes it would be both sides though. So you can have partial and full knee replacements, for example. And this shows you somebody that would have had their hips done. Actually, my grandfather, on my dad's side, had both hips this done to him. Really the last thing to talk about is a couple of disease states with this. You can have arthritis. A lot of times when we're talking about articulations is the main thing here. We have what is called osteoarthritis as well as rheumatoid arthritis. So rheumatoid arthritis, you might see commercials for this some of the time. This is actually an autoimmune disease. Your immune system is actually attacking those articular surfaces, and they give you those really withered hands. If you think about the Evil Queen in Snow White and those kind of apple tree kind of hands, that is rheumatoid arthritis. You get these really kind of bent, very rigid fingers on the hand with rheumatoid arthritis. Cause a lot of swelling and scar formation in these joints, limited movement. Osteoarthritis, this is going to be more swelling at the joints. This is a lot of times loss of the cartilage or the end of the bone, degeneration at those ones from overuse or age more than anything. And this again showing you some of that with the spine as well. You can lose some of this cartilage and have that osteoarthritis where they start collapsing on one another. And this shows you an example of that bursitis, really extreme case, but it's again fluid-filled sac that fills up in there. Showing you the bursitis that we talked about before with those bursal sacs. And really the last stuff here is a sprain. And when we're talking about joints, that is a ligament tear. So if you're talking about an ankle sprain, first degree, second degree ankle, high ankle sprain, these a lot of times they're talking about ligaments. It's a slight tear or damage to that ligament. With a strain, this is going to be more of a muscle tear. So if we're talking about a muscle strain, it could be a tendon or a ligament, a tendon or a muscle, but you can strain the muscle, you sprain ligaments.